leaving us with a food for thought. It articulates what will it take, to digitally transform the landscape when it comes to food fortification, and it sets the tone for the next presenter. We have with us Zamir Haider. He is representing NI Pakistan Country Office, and he would be presenting on the use of digitization to ensure QA/QC for food fortification and decision making. After this presentation, we would be opening the session for Q&A. Over to you, Zamir.
Thank you very much, Manasi. I hope you all can hear me loud and clear and see my screen.
Yes.
Okay, great. So my name is Zamir Haider, and I'm looking after edible oil fortification project at Nutrition International, Pakistan. And I would begin by saying that what Amit has said is uh, is really a food for thought. That transformation is not easy. So I'll be sharing. My presentation is slightly different from the ones you have had yesterday and even today. This talks about more of the ways to implement digitization in the field, uh, and also talk about the challenges we face when implementing such digital transformation at scale. So the content of this the PowerPoint I have set is that I'll be speaking about the landscape of edible oil fortification in Pakistan to set the tone in a way that you have some background that what is the overall landscape in the country? How did NI started supporting edible oil fortification in the country, and how far we have gone? And another area I wanted to talk of is sustaining progress with support from Bill and Melinda Gates Foundation, and also our experience of deployment of fortification information system. We call it Fortis. It's a digital database where you can find information about the production, premix consumption, and quality assurance and quality control testing. I would also be highlighting our experience of implementing digital tools, the iCheck Connect, with support from BioAnalyte Germany, to improve compliance and generate quality data. And we will also be knowing that how digitization has helped Nutrition International in Pakistan to improve governance of food fortification, and what were some of the key issues and challenges, and what is the way forward. So just to begin with, prior to food fortification program of Nutrition International, we found that there is a very high per capita consumption of edible oils in Pakistan, roughly 19 to 20 kgs per person per annum, and this actually made edible oil an ideal vehicle for fortification, and there was a relevant policy environment in place as edible oil fortification was mandatory since 1965's Pakistan Pure Food Rules. However, despite it being mandatory, there was limited government enforcement due to lack of technical, human resource, and laboratory equipment capacities, and there was virtually no focus on collecting and analyzing quality assurance and quality control data, and to understand the coverage and compliance. And when we were just designing the project, GAIN conducted a survey in 2017 that's called Fortification Assessment Coverage Tool Survey, which is a national level study, and they found out only 19% samples were adequately fortified. Most of the samples found in the market, and it was a national level study, were inadequately fortified, and the millers were adding just a small proportion, a portion of vitamin A and D3 premix to just get away from fines and penalties, because the government was only using qualitative methods. And as Amit said, the inadequate fortification was a real challenge. And that was the time when we got support from UK government's FCDO, and started implementing fortification, a large-scale food fortification program in 2017. Actually, the project design started in 2016, but the actual work in implementation started in 2017. So we built, it was a multi-pronged approach. It was public-private partnership, as well as working on establishing and building a relevant policy and enabling environment. So we worked on that, worked on harmonization of standards, provided training to food regulatory bodies as well as millers on fortification processes and quality assurance and quality control. Also provided necessary laboratory equipment that included HPLC, high performance liquid chromatography, eye-check testing devices, and rapid testing kits to be used in the field. And we also worked on the establishment of market-led quality assured premix supply system. This was a novel idea. We didn't establish a revolving fund where the project resources are used. We just started with the market-led supply system, where the millers would be purchasing from the premix manufacturers or their local distributors and paying directly. Whereas if they do adequate fortification, we were reimbursing a certain percentage as an incentive to them. With this comprehensive engagement with the industry, we were able to reach almost about 100% of the formal sector, and we also deployed web and Android-based application system that is called Fortis, to improve availability and quality of the data around quality assurance and quality control. And with this support, the mill's compliance to standard increased tremendously. I'll be speaking in next slides. And we were able to cover around 90% of the formal sector production. That was 200,000 tons a month, and we were reaching 120 million people annually. That was when the project with support from UK government ended in January 2021. And after that, we got another grant from Bill and Melinda Gates Foundation, and we wanted to sustain the progress made with support from UK government, and also to make a further headway to expand to the remaining areas, as well as introduce nuances around digital transformation and bringing transparency and efficiency in quality assurance and quality control. So if I could just briefly share, there have been around 65 cluster laboratories set up at food authorities and at mills, and 6,600 plus tests were performed. When this project was given, we were working with 136 males, but later on we enrolled another 10 males, which were recently set up in the country, and we increased our coverage to 220,000 metric tons a month, which is around 72% of the total national supply. And we are currently reaching out to 140 million people annually. And as I said, all 146 operational mills, no exceptions, no geographical restrictions, all 146 mills working in the country the formal sector mills. They are joining the project, and we are covering 100% of the formal sector. There is an improved and marked improvement in the capacity of producers and governments, and our adequacy of fortification improved significantly from 19% of baseline in 2016-17 to over 90%. And that's not the data we have come up with. This is according to the third-party reports or the tests performed by an independent laboratory, as well as the corresponding volumes of premix that is coming to the country. We have a very close partnership with industry association, and food regulatory bodies across the country, and almost all mills which are producing fortified edible oil, they are printing their a logo. This is a government approved logo to distinguish their products. And as I said, when we started fortification, there was a persistent under fortification. So in 2016, according to the import data, only 45 metric tons of premix was coming to the country. However, in 2020 to 2021, this premix number rose to 100 metric tons in this year, which actually indicates that and supports the numbers and the improved adequacy of fortification. We are also supporting National Fortification Alliance at the Ministry of National Health Services to get a waiver on taxes and duties, just to keep the cost of fortification by millers affordable and for a greater uptake and sustainability. And just to give you a good news that with the only the implementation for a couple of years from 17 to 19, we found a marked reduction in vitamin A deficiency in women of reproductive age from 42% to 27.3%. This is 35% reduction. And let me also share with you that there wasn't any other large-scale fortification program being implemented. So we feel that this reduction is quite attributable to the project we have been implementing. And then we have been providing numerous thousands of rapid testing kits to the food regulatory bodies. This is the picture I took from field. You can see we have provided iCheck device, which is an alternate of native of the HPLC, which is such a huge equipment and can only be used in a lab setting. So we imported these devices from BioAnalyte Germany and placed at the mobile labs, the vans, which Balochistan Food Authority and almost all food authorities in Pakistan are using. They go to places, mills, even the market, take samples and determine if it is adequately fortified or not. Similarly, we, as I said, we have been strengthening the government reference laboratories at provincial level. So this laboratory is strengthened by Nutrition International with support from BMGF as well as UK government. So this indicates the equipment which has been supplied to strengthen the food regulatory capacity of the food authorities. Now coming to the more interesting part of and the relevant part to this meeting is deployment of modern systems to improve quality assurance and quality control, as well as to improve the quality of data. It shouldn't be like garbage in, garbage out. So we rolled out and we are using Fortis to collect and synthesize data on production, premix consumption, and quality assurance and quality control. Fortis has helped us in data triangulation, because when we back in 2016, when this UK aid government large-scale food fortification project was being implemented, literally there was no information available that how much production is being done in the country and what is the consumption. And they were all just rough estimates. So when we introduced this and we started getting data from the mails on signed letterheads so that we can use that, and that was a certified data, we were able to understand that the earlier estimates were not correct, and we went back to the donor and we revised upward the targets, because we were able to achieve our targets, 1 year's target, in less than 6 months. So that's how, and as you all the speakers have rightly pointed out, there is a need for having a high quality, reliable data for decision making. So we felt the need as well, and we have been able to find out from the field that how what production the mills are doing, what percentage is adequately fortified, what premix volumes are they consuming, and what is the compliance standard from the third-party laboratories, from qualitative testing and I-check devices. Fortis has national, provincial, and district level dashboards with secure and password protected access, and it can generate actionable information for decision making. And Nutrition International Pakistan is working closely and advocating with government to integrate Fortis into their national monitoring system so that this can be sustained in the longer run. This is the snapshot taken from Fortis. You can see this data is for year 2020 to 2021. This is edible oil data, and it is for the entire country. So 204 million metric tons of edible oil was produced is going to be produced. It doesn't has data for September and October, but this is from until August 31st. And out of 146 registered mills, 121 were operational, and this production was sufficient to meet the annual per capita requirement of oil and ghee for 131 million people. So this, you can see easily how much is the production. The red indicates total production, and the green indicates the green color on the bar chart indicates the adequately fortified. And you can see almost 95+% is adequately fortified in this case. Now, under this project, the BMGF project, the current project, we went one step ahead, and we thought the Nutrition International, in collaboration with the Bioanalyte in Germany, thought to further modernize this system and to take out the human involvement from this quality assurance and quality control processes. We successfully completed beta testing of iCheck Connect at edible oil mills in the country for quality assurance. This test was done from September 21 to January 2022. We introduced iCheck devices to food authorities, and I think this is Pakistan is the only country where iCheck devices are being used for quality control by the food regulatory bodies. In all other countries, they are being used for quality assurance. Anna can correct me if I'm wrong, but I think Pakistan is the only country where we are using these devices, and we are presenting these to be used in the field as an alternative of the HPLC, so that the more rampant and regular screening in the field can be done. And we also integrated Fortis with Bioanalyte iCheck Connect to send and receive data. And oil millers and food regulatory authority staff is regularly performing tests on iCheck, and they are digitally recording fortification quality on iCheck Connect software for compilation and decision making. We are also working with food authorities to institutionalize the use of iCheck Connect of and we are advocating with them to scale up the use of devices. Only 10 devices have been given to all 4 food authorities, and we are advocating with them that they should purchase their own devices to exhibit sustainability and also use them more regularly in the field for screening purposes. And currently, an independent consulting firm is undertaking a third-party evaluation of our beta testing and digitization efforts to assess the acceptability and sustainability. These few photographs indicate how the food regulatory bodies are using the devices and inputting data on online systems. Now coming to the real part of the benefits of digitization. Digitization has helped us improving governance for food fortification in Pakistan in a way that earlier, before we introduced these modern devices, the food authorities would collect samples, they would keep it for months in their laboratories, and they'll slowly and gradually test them on HPLCs, which is not the case now. The food authorities use iCheck devices for real-time testing and reporting for enforcement, and this instant testing has bridged the gap between industry, the trust deficit between industry and regulator, and it is also minimizing the instances of disputes and litigation, which earlier used to be very regular, that industry would say that samples were not kept in a controlled environment and they were tested after 3 to 4 months, and they do not agree with the results. So this is not a new, not a practice these days. Further, iCheck devices have helped reduce workload at the central laboratories, the HPLC laboratories, and now they are bringing transparency in implementing food fortification, because both the authorities and the millers, they know that how which device is being used, and they know that their results can't be changed. It is the device which is sending the reports, so they have a fair degree of ownership of those results. Digitization is also helping address data gaps to improve decision making and course corrective action. By looking at the photos, one can immediately see where there is an under fortification happening. I'll show you how the data is shown, where is over fortification, and this can help us take course corrective actions. And iCheck Connect and Fortis is helping in uninterrupted. That this is really important. The last point, that when the COVID happened, the food regulatory bodies, Nutrition International staff, they couldn't visit mill. Neither the mills were allowing outside visitors to come. So they were performing tests and uploading data from the device. And this really helped in getting high quality data in an uninterrupted fashion, and that data was being compiled on a regular basis for utilization. So this is how the adequacy of fortification for iCheck Connect is determined. During the period from September to August, a total of 844 samples were tested, out of which 92% were adequately fortified. So this blue part indicates the adequately fortified samples. Some 2% were upper limit and 6% was under fortified. So we use this and by looking at this data, we can go back and trace which mills are under fortifying and what support they need in terms of improving their quality of fortification. And as I said, we are currently covering the current coverage is 90% of the formal sector, that is 72% of the total national supply, and I'll be sharing you where is the other 28% which is left and not covered by the project. And this another production control chart shows that where are most of the samples falling. So this is generated online. These two red lines indicate the standards, the upper limit and the lower limit of the standards, and the samples or the dots falling below or above those lines or levels, they are inadequately fortified, and we work with them to bring them under the adequacy levels of fortification. So, as I said at the beginning, transformation is hard and has been really hard for us as well. So I'll be when I'll be discussing key issues and challenges, I'll be speaking. Some of the challenges are related to overarching edible oil fortification in Pakistan, and some are very specific to digitization. So the first one is about the overall edible oil fortification regime in the country. So Pakistan has two sectors which supply edible oil to the market. One is the formal sector, which we are covering, which is the giving over 90% adequacy of fortification. But there is another sector which is lagging behind, and we have no control at the moment on it, is the informal sector, which is 28% of the total national supply. This oil is sold in loose, without refining, without packaging, and without fortification, and is unfortunately used by the poor. So this is the area where we are working with food authorities to combat and to bring such edible oil from the informal sector to the national mainstream production, so that we can fortify it. Some millers prefer to continue with their conventional and paper-based data management system, because this helps them in manipulation of data. So this is also another area we are working, and we are consistently supporting them to adopt to the digital solutions. Some millers are reluctant to share data, and they resist digitization or initiatives that bring transparency, because of the fact that they always tend to report the partial data and underreport production. This is to avoid government taxes and marking fee, and we are working with them as well to bring them on board, and asking to ensure, and we are ensuring them that the data will not be used elsewhere and will only be used for the purposes of improving the fortification. We have noticed that there is still limited human resource and geographic coverage of newly established provincial food authorities, particularly in Sindh and Balochistan provinces, which poses challenges in taking leadership role in implementation and enforcement. And similarly, such food authorities are not addressing sustained digitization, and they always need more support and handholding support. Another challenge we are facing is that bioanalyte devices are not available in country, and we are importing those devices and consumables at the moment. But most millers have expressed their inability to import these devices, and they ask consistently for making these devices available locally. So we are working with bioanalyte in this regard. We also feel that to implement and scale up digitization and ensure its sustainability, and to manage and streamline the informal sector, this requires a lot of time and resources, for which we are looking forward to work with donors to make these resources available. We also found out this is an outcome level challenge, and we are trying to address this as well. That we found that in the last two national nutrition surveys, the vitamin A deficiency reduced in both in women and children. However, vitamin D deficiency increased in both groups, and this calls for investigation that we are currently doing. And we found out in the interim assessment that we are adding too little of vitamin D at the level of or at the point of fortification, and that needs to be increased at least 2 to 3 fold. So I'll be in the next slide, which is the last slide, and I'll be talking about what needs to be done. Another challenge we have found, and this is how we should also be giving it some more attention, is that the quality of edible oil which is fortified is really important, because if it is of poor quality oil which is being fortified and is higher in free fatty acid values, peroxide values, and the way it is being used by the consumers in repeated fryings, and it is packaged in transparent films, it is really not achieving the health objectives of the fortification. So we are advocating and educating the millers, government food authorities, and consumers to protect whatever has been added as a result of fortification in this. So this is the last slide. I'm sorry if I've taken long, but I'll just be winding it up. What needs to be done, or what is on our radar in the near future, is that we will continue working closely with federal and provincial regulatory bodies to combat the sale of loose oil, to achieve the pro-poor objectives of fortification. We are also making efforts to develop an ecosystem for scaling up, sustaining, and institutionalizing digitization into government monitoring and reporting system. That's the key, because we can do it, but what if we go and phase out and it stops there and then? So we are working with food authorities to adopt these checklists, these tools into their own system, and embed them in a way that they could use beyond the project life. We are also working with BioAnalyte to explore possibilities to ensure local supply system for iCheck and vials, and also fixing some data privacy and safety issues on their iCheck Connect software. Another interesting ask by the government is that they are asking to explore local digital solutions using in-country technologies. Nutrition International is also giving due consideration to this request, and we are exploring what can be done to improve the digitization using indigenous tools and techniques. And as I said, vitamin D hasn't gone better. We are undertaking an assessment of vitamin D impact among priority population groups to inform revision of vitamin D levels at national fortification standards. And we are also disseminating lesson learns from with other partners and other NI country offices to take advantage of the learning from field. And last but not the least, I would say that unless we do not integrate fortification into broader food safety and quality regime of the food authorities, I think its sustainability is hard to achieve. And as Dr. Luz said, food safety is a key, and I think all fortification interventions should be embedded into the broader food safety and quality regime, so that it doesn't keep aloof and separate, and it is well institutionalized into the food safety and quality systems of the food authorities. And with that, I thank you all for your patience, and I'm sorry if it went a little over than allocated time.
Thank you, Zamir, for sharing the Pakistan journey and experience with us. I'm sure this would serve as a case study for similar country contexts. And congratulations to the team for achieving, more than 90% compliance in a span of 3 years.